My experience of endometriosis started I believe it started when I was quite young. So probably when I was at secondary school. It started with really bad period pains, which at the time I thought or deemed as normal, because I'd had family members that suffered similar. So to me, that was something that was expected. So that continued for some time, and I'd often be in the nurse's room, doubled over in agony, having to take medication for pain relief. And then as time went by, I got more and more symptoms, which didn't really connect at the time. So extreme tiredness, used to get quite poorly frequently. It took me longer to fight things off. And after numerous visits to the doctors, eventually in my sort of early 20s, I was referred due to sort of stomach problems to a gastro team, and was diagnosed with inflammation, basically gastritis. Wasn't given any reasons or cause for that. No treatment. Just put down to the umbrella of IBS. So that was sort of the start of things, really, without me knowing it. Again, symptoms escalated. More and more things began to happen. And as I got further on in my I suppose, recognition of what was sort of happening to my body, and more doctor's appointments, and not really getting to the bottom of it. Sometimes question whether it was in my head, whether I was feeling pain more than other people did, or, the symptoms were all sort of separate incidents. So after some time then, as I'd gotten a little bit older, I ended up where I was teaching an evening class, and was there really late. The pain became excruciating. I felt physically sick. On getting home, travelling home on a journey home on the train, I felt like I was going to pass out, and realised that something really, really wasn't right. So after a GP trip, I got referred for a scan, and they found a cyst on my ovary, which is quite common, so it didn't raise any initial alarm bells. Kept going back for scans because the cyst can reduce on its own, so they can burst, but this one didn't. So eventually, because it wasn't changing and it was quite large, they referred me to a consultant. Within 5 minutes, he said, "I think you may have endometriosis." It was the first time I'd heard the word endometriosis, after all the years of pain and various symptoms. And then he booked me in for surgery. So unfortunately, from my experiences, the only way of me getting a diagnosis was to have invasive surgery, which is a lot to go through. So in terms of treatments, there's not a lot available. I was advised to have, I would probably say pushed to have Mirena coil, which I didn't feel comfortable with. I'd heard a lot of stories and experiences that were quite negative, but personally I just felt it wasn't for me. Knowing your own body and knowing how it might reject things, and how I was sort of prone to infections, I decided that I didn't want that. So I kept pushing through and just took pain relief. And then they eventually, after some years, mentioned an injection that you could have. But obviously it comes with side effects, so it puts you into early menopause. So you're almost swapping, or a trade-off, for one symptom for another, which I decided that the pain was worth it, so to take that option. After doing some reading around it, that's why I hesitated initially, because it can come with all sorts of side effects, some that are quite nasty, but I decided that I'd give it a go, and actually for me it worked. You are only supposed to be on it temporarily, but I've been on it now, on and off, with breaks in between, for over 12 months, because for me it works and it stops the pain. However, then you get all the joint pain and the menopause symptoms, so hot flashes, etc. Okay, so in terms of what's next, every time I go to see my consultant, which the one I'm under now is really good, when I do get to see him, it's just not that frequent. And I've had missed appointments, not from my end, from the clinic where they've not re-engaged with me or followed up. Maybe assuming that you're okay, but you're never okay. You have good days, bad days, etc. So it's a constant. When you do get to see the consultant, they will sit down with you and discuss how that treatment's progressing, whether it's working, and maybe what next. A question that I've often asked is around hysterectomy, but that's not something that they tend to do more frequently now, because whilst it may alleviate the pain in the periods, it doesn't fix the issue, because the endometriosis can move to different parts of your body. So the treatment's very specific to that area, pelvic area, and it's linked to, so the one that I'm on at the moment is a hormone suppressant, but then as a result of that, your bones can become deficient, and they weaken. So I've had to have bone scans as well. So longer term, it's not something that you can stay on. So I'm just waiting for another result back from a bone scan to then determine what comes next. But I've exhausted that option. The next option will be surgery again, to which I've now got a small amount on my bowel, which comes with a risk. So they're trying to delay that, hence why I've been on this treatment, because that's more complicated surgery and it comes with potential risks. So everything's a worry, and there's no cure or definitive answer. Even to have a hysterectomy, which a lot of people are under the belief fixes it, it doesn't, because the endometriosis can be all over your body, and hormone replacement therapy then escalates those symptoms again. So with endometriosis, it comes with really intense pain, as well as other symptoms. The thing that I would liken the pain to is labour pain, to childbirth at its worst. Obviously having children, I know that. Beforehand, I didn't know what that pain was like, but imagine that was what it was similar to. And it's like the contractions that you get when you're in labour, so it can take your breath away. It can stop you in your tracks, so you can be up getting ready for work, be absolutely fine, and then 5 minutes later this intense pain comes on and you've got to sit down or lay down. You know, when you're trying to go about your day-to-day life, that's hard to factor in if you have a career like I do, and you know, you're trying to sort of push through and you're determined not to let it win. But the pain sometimes just beats you, it takes over. So you have to give into it to an element, and it'll come in a wave and then it may go again. Other days it may come in a block, 3-4 hours in waves. There's no rhyme or reason to it. So it's really hard to forecast. Obviously there are, for me, in a month when I'm not on the injection and there's that cycle, there's only a week out of those 4 weeks where I feel not great, but okay. There's the week before when all the hormonal symptoms come and you get pre-pain, which again seems to be intense, affects the bladder as well, and other things, fatigue. Then there's the week when you go through your period, which is horrendous, and obviously you're coming into work and you're dealing with all that as well, and trying to sort of hold down a normal carry on. And then the week after, when you're exhausted because your body's trying to recover from that week before. And I've also had iron deficiency, vitamin D deficiency. There's a lot of other things that are connected to it. I've had a broken rib because of the vitamin D, which later then they discovered. I was told that at the time that I'd pulled a muscle, dismissed by doctors, not investigated. It was only when I went back to see a female doctor that she referred me for an x-ray, and they confirmed that I'd had a broken rib. I'd been going into work with a broken rib, and, you know, struggling to breathe.